बाहर देख ले
a useful, productive event for all of you and all of us here. That it be blessed with knowledge, useful knowledge that we can all use to better our lives. We're joined here, and it's good fortune for us that we're joined here by Mr. Tariq Hussain, as well as Mr. Greg Seal. And Greg has come from out of town. They're both experts in Medicare, Medicaid, and Social Security. So it was, I think, over a month ago, month and a half, 2 months ago, that I ran into Tariq Bhai and we started talking about what are the needs of the community. And one of the things we thought about is there's a lot going on in terms of changes to Social Security, Medicare benefits, Medicaid benefits. The question remains in all our minds, even amongst elders in my family, in terms of what's going on, how's it going to impact me, how do I claim them, I'm getting close to that age, I'm beyond that age, am I going to continue getting them? So we figured that one of the things that we should do is organize a workshop where the experts in the field would talk about what is Medicare, Medicaid, how to claim it, what is Social Security, what are the requirements for it, what are the resources available that you guys can access, inshallah, and utilize your well-earned benefits that you've been investing towards all your lives, inshallah. So with that, I wanted to invite Tariq Bhai to kick it off, inshallah, and then please do support Mr. Greg Seal as well. He's come from Ohio, 5-hour drive, and heading back today. And we thank you very much, Greg, for making the effort that you're making for us. Jazakallah.
ربي يسر ولا تبصر وتفضل الخير إياك نعبد وإياك نستعين يا فتاح يا فتاح يا فتاح. Please don't be impressed with my ability to make du'as. I learned them from my wife. She's an alma, so it's something that the learning process goes on. Before we start, I would like to thank the management of this masjid, who have very kindly agreed to this session today, and the president, Brother Imran, has been instrumental in approval in the process of saying yes. Whereas the initiation was made by Akbar Pasha Bhai, mashallah, he's the one been working with me from the concept stages up to today. Frankly, I was hoping to have more people today. Nonetheless, whatsoever is here, whosoever is here, alhamdulillah, if everybody has not written down their names and their phone numbers, the idea is not to call you or bother you later on, but the idea is to see that the main reason for this presentation is an educational reason, educational process. We learn from one another. I don't claim to be an expert on the subject, but yes, I have learned a little bit. Greg absolutely is an expert. He's been my coach in the business, and a great person to work with. And the very fact that he has traveled all the way from Ohio, 5 hours drive, just to complement our efforts, is a matter of great consideration, and we are grateful to him. So Bismillah ar-Rahman ar-Rahim. I will start with my PowerPoint presentation, and I will confine my presentation to Social Security benefits. Now, since the presentation is very timed, I will request the audience here to refrain from the question and answers, because what happens when the question and answer starts between the presentation, if it is an hour-long presentation or half an hour long, it becomes twice as long. And some people who may not have the time to go and wait for that long time will miss so many parts of the important parts of the presentation because they have to go and go home or whatever. So question and answers could be done at the end of the session when Greg and myself, we have finished doing our presentation. That's one thing. And the other reason is that after I'm done with my PowerPoint presentation, I will give a little bit of familiarization tour with the Social Security benefits website. So, if I have a fish on my plate and I want to share it with you is one thing, but if we all learn to go fishing and we know where to find and how to do fishing, then we don't really need the question and answer because we have the answers and we know where to find them. So here we go. So as we said that this is a seminar on Social Security benefits and Medicare. One thing that we want to so I will start with the disclaimer. I want to make sure that nobody mistakes us for representing the government department. We are not from Social Security department. We are not from Medicare department. We are only here to share with you the little we know. And if you want the exact information to be sure, we will go through it during the presentation that we can go learn it from the horse's mouth, from their own websites. Okay. So this is my disclaimer and start with. Okay, so this is once again Gregory Seals. He's going to be doing the Medicare presentation. Now, if I don't know how many of us plan to buy a Ferrari tomorrow morning or a Cadillac or a Rolls Royce. Maybe some of us do, inshallah. But I do know that most of us expect to have the benefits from Social Security. That's why we are here. That's definitely one thing that we know about. So we always try to request the audience to make sure you go on the website and open an account for yourself. It is imperative. It's very important that you need to have your own account of Social Security benefits. And once you have opened an account, it will walk you through all your Q&As. You will find everything over there. This is ssa.gov. If you want the phone number, it is there. You can write it down. You can take pictures if you want. And they are open from 8 o'clock in the morning to 7 o'clock. Try getting them online. You will be lucky. I didn't say that.
Can you go the slide back, please?
Yeah, absolutely. So this is the phone number, and this is the website. You're welcome. Now, planning your retirement. We all need to make plans in our life. The worst plan is no plan. If you don't have a plan, that's the worst planning. So you need to start planning for your Social Security benefits, for your Medicare benefits. When do you get it? If you start planning right from earlier than you are 62, that's the best time to do it. You need to find out facts and figures. How do they do it? They consider your 35 maximum, the best performance quarters from the last 40 quarters. If you have worked for 10 years, then the best 35 quarters means there are 4 quarters in a year. So how will they calculate? They will calculate your maximum earnings for the 35 quarters out of the 40. And based on those 35 quarters, they will determine how much you're going to be earning in your Social Security benefits. Some people want to apply for Social Security benefit as soon as they are 62 or 63 earlier, but they lose money. The best thing to do is to wait if you can, and if you reach your FRA, full retirement age, that is when you get your entitlement, whatever your full entitlement is. If you continue to wait another year, you get another 8%, another year, another 8% until you are at the age of 70. And that is where you get your maximum Social Security. You will not gain any more if you wait beyond the age of 70. So that's what we are seeing in this slide here. Okay, when is my full retirement age? Gentlemen, if you are born between 43 and 54, at the moment, the government says your full retirement age is 66. Every year after 54, you add 2 months. So for example, if you were born in 1958, your full retirement age is 66 years plus 8 months. That is your full retirement age. If you are born in 1960 or beyond, then your full retirement age is 67. That's where the government will tell you that, oh, now you are FRA and you will get your total entitlement. Not the maximum you will get when you are 70, but your actual full entitlement. Like we just mentioned, at the age of 62, and if you apply and you get it, there will be deductions. You will get your entitlement at FRA at whatever your age may be, and then you get the maximum at the age of 70. Now, we want to say, how much am I going to be getting? Well, let's see. I don't know how much I'm going to be getting. Well, there's no need to guess. There is an estimator that we will come on the website. We will talk about it, and they will tell you exactly how much you will be getting. So to reiterate, at the age of 62, you will lose good about 25 to 30% comparatively, as in when if you apply when you are at your full retirement age. And after your full retirement age, every year that you wait, you will gain another 8%. So the idea is to please, if you can afford it, if your martial learning is good, wait until you are 70 and then apply. Spouses of retired eligible wager. Spouses who never worked or have low earnings can get up to half of a retired worker's benefit. If applied before FRA, benefits can be as low as 32. So it is better to wait until. Now, the spouse who wants to apply should also wait for that maximum benefit or the entitlement benefit of 66 or whatever the age may be. If she or he wants to apply before that, then there will be reductions. There is a exception over here. Spouse can get full benefits regardless of age of taking care of a child under 16 years. If a gentleman has been getting benefits, social security benefits, and the Begum Saab, the wife, wants to apply before she is 60 or 62 or whatever, the full retirement age. If she's taking care of a child who is 16 years or disabled before 22 years of age. However, the other spouse has to be already earning social security benefits. Average, we want to, we keep saying how much is someone getting, how much is so-and-so getting, how much. The average across the nation is 1,900, and the maximum people get is 4,800. That is some figure from the department. Now, people wonder that, if you are earning $500,000 a year, if you're earning $2 million a year, is the government going to take the tax out of my earnings every year from that my earning amount? Or is there a pick-off figure? So yes, there is. There is a limit beyond which they will not tax you. In 2024, the amount was 168,600. That is the maximum amount that they will tax you for your Social Security and Medicare. And how they do it is 6.2% of your gross wages, it goes to Social Security tax. 1.45 gross wages, they go to Medicare tax. And then the total of 15.3 is to be met by your employer. Employer has to put the difference to be able to make it entire total of 15.3. And if you're not working, you're on your own, then you have to pay the entire 15.3 on your own towards these two taxes. I'm not a tax person. There's a tax person sitting over here. So I'm not going anything beyond what I'm saying. Is there any increase every year? Yes, there is an increase because the cost of living continues to go up. And the cost of living, the limit that is considered by the government is COLA. It's not Coca-Cola. It's known as cost of living benefits, COLA. And in 2024, it went up by 3.2%. Okay, now working while collecting benefits. Now, if you're 62, we will go into a little bit in detail on the website. We will find out where to look for it and how to look for it and how much is the exact. Sorry. So at 62, you will lose $1 for every $2 that you earn beyond a limit. That limit is $23,400. So if, for example, if you're earning $24,000 at the age of 63 or 62, let's say, like I mentioned over here, you are earning how much more than $23,400? You're earning $600 more, right? So they will take $1 from every $2. That means they will take $300 away. Is that right, sir? Okay. Sometimes I get my math right. When you are at full FRA, at FRA age, you will lose $1 for every $3. Anything, now the amount changes. The amount has gone up to 62,160 per year. And after FRA, full retirement age, you get to keep everything that you earn. They don't deduct anything. Okay, so for more, people go, let's do it now. How work affects you, okay. So here we go. Now, brothers, this is the Social Security benefits website. I really urge each and every one of you to familiarize yourself with this, play with it, research it, find out. Your question and answers will be very easily answered over here. Now, for example, it says how my earnings. What was the question? Yeah, how work affects my benefits. Okay. Let's put this question. If I'm working, then say how work affects my benefits. Okay, and this effect is with AI. Now you put that question over there, and let's see it. Something has gone wrong. My apologies, gentlemen.
It's not changing on the TV screen.
Oh, you want to change it? I want to change it.
We want the TV to show.
Yeah, sure.
There you go. Share the desktop. Share the screen. So I think you have to
Okay, well, I have to come back to my PowerPoint.
You just click on your PowerPoint over there and shove that change over.
Oh,
Yeah, now we're duplicating this.
So the question is, if I'm working, how does my work affect my benefits? If you go to the Social Security website and you search for this question, you get to this page. And on this page, there are different headings. Let's look at this. This is where they are telling you exactly how it affects your benefits. If you reach full retirement age in 2025, you must deduct $1 from your benefits for every $3 earned above the same amount like we were talking about. And the good thing over here is which I never did not cover so far, that, for example, if your entitlement is $600 per month and you go a little bit beyond, then they are going to keep a certain amount. In this case, they are showing that we have earned $25,000 and the limit is $23,400, which is $600 more. So they're saying to do this, we would withhold all benefits payments from January through February for 2 months, which means they're withholding $1 for every $2. Beginning March, the same year, they would give you back that money. So they have their ways of doing it, and here they have given a chart that if your benefits are so much and you earn so much and so and so forth. So all your question and answers, the session of Q&As, this is going to take care of it. You don't even have to open an account. Just go Social Security SSA.gov, boom. Put any question you want over there and you get the answer. You don't even have to have an account. Most of the time you will know what they are talking about. So this was a demonstration from. Okay, so slide is. The disability pays benefits in 2 ways. To certain family members, if you meet the criteria. I mean, if somebody is earning Social Security benefits and becomes disabled, or even before that, then you go to the government, you can, we'll come to that. Supplement Security Income Program pays benefits to disabled adults and children who have limited income and resources. We will go into that. Survivor's benefits. If somebody is earning Social Security and passes away, and the family says, what do we do now? We are left with lots of questions and we don't know where to go. So the government will take care of you. Certain family members, like spouses, children, and parents affected by the death of a wage earner who worked long enough, 10 years, may be eligible to receive monthly benefits, including a widow or a widower age 60 or older, age 50 or older if disabled, a surviving divorced spouse under certain circumstances. Yeah. Oh, yeah. Thank you. A widow or a widower at any age who is taking care of a deceased child, if the person who has passed away, his child or her child, the child is under 16 or disabled and receiving benefits. An unmarried child of the deceased who is younger than 18 or up to 19 years, full student in an elementary school or another school, or age 18 or older. So we will go onto the website for a little more knowledge on this. Now, spouses of deceased wage earner. After divorce, former spouse of age 60 or older, 50 or older if disabled, under certain conditions can claim benefits if marriage lasted at least 10 years. Now, the wage earner has passed away and left behind a spouse who's divorced. The divorced spouse can claim benefits under certain conditions, obviously. For example, the age of the length of marriage does not matter if taking care of a child younger than 16. Now, somebody passes away and you report the death to the Social Security. What they do is they give you a total of $255. And it is obviously not sufficient enough for a funeral or for a burial, but that's what they do. And you must claim that money within the first 2 years. So that being the end of the PowerPoint presentation. Again, we are in the dark. This is the dark ages.
Shut up.
Sorry about that, gentlemen.
What is that? Technical glitches. It's not connecting. It's not. Jealous.
All right, there we go. We are in. So now, as a demonstration only, as just to getting familiarized, let's put another question here: estimator. This is going to estimate, how much you can get and things like that. If you have an account, this is where you will go. And if you don't have an account, then you will get the retirement spousal benefit. Let's see if I can what this is. Help. We want to see that this lady can be heard.
We don't have like any audio.
Oh, we don't have that.
Yeah, I think we just have to unmute this stuff.
Oh, is it? No, it's not.
It's not.
Because we are not extending the sound.
Okay.
Yeah.
I think it won't come up. If you want to send, then probably we need to disconnect.
Again.
Yeah, I mean only it will come in your.
Never
laptop.
mind.
There's no extended to the.
This lady is basically telling us in the website. You can see it for yourself. She's just giving us a 2-minute speech and telling us how the thing works. And I need to go back to where I was. We'll get rid of this. Yeah, thank you. Thank you. Jazakallah khair. So the basic idea is to when does my when to start? That's the purpose. This is a chart. It's telling you what you earn at what stage, at what age. These are the ages, and this is what you earn, a rough estimate. So if you want to precisely know your own earnings, then obviously, like I said, you have to open an account, and then you will put that question over there in search, and you will have the entire amount. They will show it to you, your past, your present, and your future. So as long as we know where to go to answer our questions, this will address most of your questions. And I don't want to lengthen our presentation because Mr. Greg Seals has yet to come up to the podium and cover the Medicare benefits. So I thank you for being a great audience. Inshallah, we will.
I have a quick question, a little off track, like for non-citizens, can they claim like social benefits if they work for like 40
quarters?
40 quarters.
Yeah, if you have a green card, you are entitled for everything except that you cannot vote. And good that you didn't vote for, like, so. So
if you don't have a green card and then you still work for like 40 quarters, then
no, you have to have. How will you? If you don't have how will you pay your taxes?
I mean, in my taxes, I'm still paying Social Security.
You are paying Social Security. There is something that I will need to come back to you. Let me have your name and phone number. I will have to come back. Like I said, I'm not an expert, but this is something that I really need to share with you as a learning process.
Yeah.
So inshallah, you have been a great help. I'll be a great help for you.
And Sergi, this is being live streamed on YouTube, so if you wouldn't mind repeating the questions that are being asked by the audience, so the folks online can listen to them as well.
Okay, the question asked by one of our audience, one of our brothers here, is that if somebody does not have a citizenship, does not have a green card, and is still legible enough and is still legal enough to pay the taxes, the Social Security taxes and the Medicaid taxes, will they be entitled to get the money when they reach a full retirement age, or will they be eligible for the benefits? So this is something that I would like to find out for myself and get back to the.
I think the answer is yes, because you paid to the government and you're not retired yet. So wait till you get to 62 or 65, then you will get it. There is no doubt about it.
Right. So we will have to make. I cannot stand here at the podium and say something that I don't know. But the audience can obviously share their own opinion. That's good enough. Thank you. Thank you. So thank you very much. And I request Mr. Greg Seals, Gregory, to come onto the podium. Thank you.
Medicare benefit never has been Medicare such a but
Okay. I will take this out.
Thank you for having me. Nice job, Sayed. And I've worked with Mr. Hussein for a few years now, specifically in the Medicare space. So much like Social Security, it's something that you have to pay into for 10 years, 40 quarters. before you're eligible for these resources. And I think Medicare is even as confusing or more confusing than Social Security. Thank you. Perfect. Thank you. So I got a little PowerPoint I'm going to run through with this as well. And people can ask any questions at any time. And I thank you for having me. And my presentation is just all about Medicare, what it is, and understanding your options. Very confusing with some of the television commercials, and I think people, as they approach their 65th birthday, Social Security can draw as early as age 62, and that full retirement age is based on your birth year. Medicare is always your 65th birthday you become eligible, unless someone's been drawing SSDI, which is disability, for 24 consecutive months, then they would qualify for Medicare under the age of 65. So basically you have to be 65 and older on SSDI for 24 consecutive months, or anyone that has end-stage renal disease or ALS is automatically eligible for Medicare. And in layman's terms, Medicare is really U.S. retiree healthcare system, to put it in layman's terms. And this is the information we just kind of discussed: 65 and older, SSDI, Social Security disability income payments for 24 consecutive months, or anyone that has end-stage renal disease, which is kidney disease, or ALS. And I think the answer to our previous question was U.S. citizen or permanent resident for 5 consecutive years would make people eligible for Social Security and Medicare benefits. If someone is drawing Social Security before they turn 65 years old, they will get Medicare automatically. If someone is not drawing their Social Security benefits at age 65 because they're waiting, letting that Social Security payment bake / increase, if you wait to take it, then you have to apply for Medicare manually. And there's 3 options to do so. You can use that same Social Security SSA.gov website. What I do like about the SSA website is if you do create an account and log in, your own personal statement will be on there. So you can look at your, last 20, 30, 40 years of earnings, and it'll tell you exactly what your payment is projected to be. So that's pretty informative info. You can also call Social Security directly, or you can go into your local Social Security office, are ways that people can apply for Medicare once they're eligible. So just to talk about Medicare in detail, there's really 2 parts to Medicare, Part A and Part B. And this is what the Medicare card looks like. And I think one of the main reasons Medicare is so confusing is because if you're not eligible until you're 65, when you're 40, 50, 60 years old and not eligible, no one really researches it and looks into it. Before you know it, we turn 65, and it's like a foreign language. It can be very confusing. This is a picture of the red, white, and blue card, which is the Medicare card. And as you can see, there's 2 parts. There's Part A and Part B. Part A is for hospitalization, and Part B is for medical services outside of a hospital, like doctor's office visits, physical therapy, outpatient surgery, things of that nature. I was just kind of explaining that Part A is for inpatient hospital care, also skilled nursing care or hospice care falls under Part A. And non-skilled care outside of a hospital or skilled nursing home or hospice, it falls under Part B. The cost for Part A is free, assuming you've paid into Social Security for 10 years or 40 quarters, so there's no cost to Part A. However, there is a cost for Part B, and the cost for Part B is $185 a month. Usually, you can see it's actually based on income. So if someone has Medicare and Medicaid, they are not required to pay the Part B Medicare premium. And if someone is single, widowed, or divorced, and making more than $106,000 a year, then the cost of Medicare is income related. So it can go up as high as about $600 a month. Most people, when they retire, if single or under that 100K number, or if married under the 200K number, in which case the monthly premium for Medicare is $185. Since we're talking about the Medicare premium, I know a lot of people when they retire are on a fixed income. Many people are heavily reliant on their Social Security benefits as one of their main sources of retirement income. And one of the things that's been popular with some of the Medicare plans in the last few years is there are Medicare plans that offer a Part B premium rebate. So some of these plans will give you 50 or 100. In Cook County, Devoted, which is a health insurance carrier, offers a $132 Part B rebate. Cigna offers a $100 rebate. Some of these different plans have Part B rebates to offset this Part B premium. When someone turns 65, they need to enroll in Medicare, or else they could be penalized with a late enrollment penalty. So one of the reasons why we're doing the educational event is because Sam and I would like to be resources for you, for your family, for your friends, neighbors. If you know someone that's turning 65 years old, just so we can make sure people are signed up in time, so there is not a late enrollment penalty, and we're able to provide the clarity and education that people need to know to understand the different choices and options. As I was saying, Medicare basically covers 80%, which is good. However, people are on their own for the 20%. And as you can imagine, medical services are very expensive. So most people, when they turn 65 and become eligible for Medicare, look at a Medicare plan of some type to pick up the 20% that Medicare doesn't cover. Also, people have to have Part D, as in dog prescription drug coverage, so they can afford their medications as they age. And if they don't have prescription drug coverage, there's also a late enrollment penalty. So there are a couple different ways that we can cover the 20% and cover prescription drugs. One way is the Medicare supplement plan, also known as Medigap. And the Medicare supplement / Medigap, they mean the same thing, two different names. What it does is it basically covers the 20% that Medicare doesn't cover. So it's very comprehensive insurance. I think it's the best insurance that money can buy. There's no co-pays, there's no networks, there's basically no out-of-pocket cost or very little out-of-pocket cost. It's excellent insurance. Not everyone can afford the Medicare supplement. As we mentioned, Medicare itself on average costs $185. And then the Medicare supplement, and it's based on the state in which you live in. So I was looking at the cost in Illinois for a common Medicare supplement plan. It was about $188 a month, which means $188 for the supplement and then $185 for Medicare. And then the supplement does not include prescription drug coverage. So by the time we add a supplement, drug coverage on top of the Medicare premium, we're probably talking about $400 a month as far as what the Medicare supplement plan would cost, all in with prescription drug coverage and the Part B Medicare premium. I can tell you that 80% of people today are going with a Medicare Advantage plan. And the reason why people are looking at Medicare Advantage plans, or why Medicare Advantage plans tend to be more common today, is because of affordability. The Medicare Advantage plans do include prescription drug coverage. They also include dental, hearing, and vision benefits, which original Medicare doesn't cover. So the Advantage plans cover the 20%. They include prescription drug coverage, and they also include dental, hearing, and vision benefits. And the cost of these Advantage plans are usually $0. So from a premium perspective, the Medicare Advantage plan is more affordable because you're only paying the $185 Part B Medicare premium compared to the Medicare Supplement plan. You're paying the supplement premium, a drug plan premium, the Medicare Part B premium, and original Medicare does not cover dental, hearing, or vision. So those ancillary benefits would also be an additional cost. That's really what we do for people, is we meet and review what they have, make sure they understand what they're paying in premiums and what their out-of-pocket cost exposure is. On the Advantage plans, we have to make sure your doctors are in the carrier's network. And on the Advantage plan, because it is a zero premium, there's cost sharing. So you have to pay co-pays when you see a specialist, co-pays when you go to a hospital, co-pays when and if you have surgery. You pay as you go on an Advantage plan, and max out of pocket in Chicago is probably around $2,500, maybe between $2,000 and $3,000 a year. That would be worst case scenario. So if someone's on an Advantage plan, they could not spend more than the maximum out of pocket on the Advantage plan. I know Humana has a $2,100 max, and Cigna has a $2,300 max. Those are the least amount of out-of-pocket cost on the Advantage plans in this area. On the supplement plan, there are no out-of-pocket costs, but of course you're paying a higher premium. You're paying for comprehensive insurance on the supplement. So I know that can be confusing. I'm happy to answer any questions as we go. For folks that have Medicare and Medicaid, Medicaid will subsidize the Medicare premium, and they are also not required to do any cost sharing as they see doctors. So essentially Medicaid equates to affordable health care, subsidized health care, and there are dual special needs plans for people that have both Medicare and Medicaid, and there is no cost when you have Medicare and Medicaid. And these plans provide a lot of extra benefits like dental, hearing, vision. A lot of the dual plans now give you a monthly over-the-counter debit card for groceries and utility bills, as well as dental, hearing, and vision, and usually a gym membership. So just wanted to talk a little bit about the dual plans. There's plans that are designed specifically for veterans who get most of their health care and medicine through the VA. And there's also chronic special needs plans for the people that have a chronic health condition like diabetes or heart disease, which unfortunately is about 3/4 of our seniors qualify for a chronic health plan. So one of the things that's confusing about Medicare is you just can't, you get a free pass to, to evaluate your options and jump on a plan when you turn 65. Once you enroll in a plan, you have to have an election period in order to switch these plans. So on the screen here is a couple different enrollment periods. The initial enrollment period happens 3 months before you turn 65, the month of, and 3 months after. There's basically a 7-month window to enroll in a Medicare plan. There's special enrollment periods that people have available in the event that they move, or if they lose their job, or if they go through a divorce, there's a SCP, which is an election period for special circumstances. Every year in Q4, October 15th through December 7th is the annual enrollment period. And then from January through March, which is Q1, is a time when people can swap Medicare plans if for whatever reason they're not happy with the decision they made with the current plan. We usually see that happen when someone turns 65, they're healthy, maybe don't even see a specialist, have minimal co-pays. If someone's health would change, stroke, heart attack, car accident, now we have specialists and treatments and follow-ups and co-pays. You're able to switch plans once a year to a different plan that would potentially have lower co-pays when you see doctors or hospital stays and medical services. So you're not tied to these plans. You can switch them every year. There's no underwriting when it comes to the Advantage plan. There is underwriting when it comes to the supplement. Someone gets a free pass for the first 6 months in which they turn 65 to jump on a supplement plan. And again, the supplement's great because there's no network. There's international coverage. You can see any doctor or go to any hospital. There are no out-of-network issues or network limitations. It's just you have to pay for the supplement, which again is about $190 a month. And you have to buy a standalone Part D prescription drug plan to go with that. And these drug plans range from probably $20 to $100. And the way we figure out which prescription drug plan fits or which plan works is we're always asking, you know, which doctors you see, your family doctor, any specialist that you consult with, and what medications you take. And we need the name of the medication and the dosage and the frequency, and we're able to make a suitable recommendation on how we can get a plan that takes all your doctors and all your drugs. And you know, that data is important because not all the carriers contract with all the doctors. So any questions on Medicare? Go ahead.
I've got two questions.
Yeah, go ahead.
Number one, the supplement versus Advantage. Supplements, you are paying $190. In the Advantage, they're giving you the benefits. Where do they make the money on Advantage to offer you free of charge coverages and the freebies that they're offering?
Good question. So the question was, if there's two options, because the good news is there are only two options, Medicare supplement and or Medicare Advantage, even though there's a kind of a variety pack of both of those options. And as you said, the Med Sup you pay for. So $200 a month plus probably $50 for a drug plan. We're all in for $250 plus the $185, around $400 all in. And the people that have the Medicare supplement are usually very happy with that. The persistency on that business is 95%. Just because there's no issues, there's no out-of-pocket cost. It's just an ongoing expense is the problem. With the Medicare Advantage plan, instead of comprehensive insurance, it's really a cost-sharing program. So what happens is the premium is $0. So therefore, you're only paying $185 for Medicare instead of $400. You're saving a couple $100 a month in premiums on the Advantage plan. But you're exposed to co-pays on the Advantage plan that you don't pay on the supplement. So if people are in good health when they turn 65 and they only see their doctor once or twice a year, you know, paying 1 or 2 co-pays a year is manageable and affordable, and it works great. My father-in-law is on a Medicare Advantage plan. He's blessed with good health. He doesn't take any meds. He doesn't see any specialists. These Advantage plans include dental, hearing, and vision. He loves the plan. The issue could be if someone's health changes, they could spend in the max out of pocket, which is thousands of dollars, $2,000, $3,000, $4,000 a year in out of pocket cost exposure on the Advantage that you're not exposed to on the supplement plan. And so I think what's happening is CMS, which is the Center for Medicare Services, the government division that runs Medicare and Social Security, you know, they're paying these insurance carriers, they're to manufacture the Medicare Advantage plans. So people that enroll in these plans, when you're on an Advantage plan, it trumps original Medicare. So if you enroll in a United Healthcare or an Aetna or a Humana plan, now you have to see doctors that accept the insurance carriers.
You got restricted.
You're restricted to seeing any doctor that you want. You're limited to a local network on the Advantage plan. So it works very well for people that are healthy. It doesn't work so hot for people that have 4 or 5 specialists, and that individual would pay a lot of co-pays on the Advantage plan. So these are not one size fits all. My mom was sick before she turned 65. We put her on a Medicare supplement plan knowing she could see any physicians, providers, specialists in the country, and she would have no out-of-pocket cost sharing. Whereas if my mom was on the Advantage plan, the Advantage plans in Ohio are about double out-of-pocket cost in Illinois. She would have paid $5,000, $6,000, $7,000 a year out of her pocket on the Advantage plan, which would have ended up being more expensive than the supplement plan in her situation. So the Advantage plans work fantastic for people that are healthy, don't see a lot of doctors. And as people age and their health changes, people just need to understand they can pay a lot of co-pays on a Medicare Advantage plan.
And you can switch at the time of enrollment, open enrollment.
Annual enrollment period, which is Q4 every year, gives you the flexibility of changing plans for the upcoming year, and there's never any underwriting.
My second question is, if you are planning on working beyond the age of 65, and you have ability to get insurance from your place of work, versus the Medicare, what's the rules and benefits?
That's a great question. So the question was, what happens when someone wants to work beyond the age of 65? Maybe because you can only golf so much. A lot of people would be bored. A lot of people are in their peak earning season when they're in their 60s and not ready to retire. So normally, if someone is retired by the age of 65, the 2 options were Medicare supplement with a standalone Part D plan or a Medicare Advantage plan. For the people that are able to work beyond the age of 65, they simply have 3 choices. So we can opt out of Medicare Part B, so you don't have to duplicate premiums and pay the $185 when you have group insurance through your employer or through your spouse's employer. So really it becomes 3 options instead of 2. And everybody's situation is different. Most of the time I would say going with Medicare, even if we went with the Med Sup and a standalone drug plan, which would be the more expensive option usually, that's usually more economical than employer group insurance coverage. My wife works at our local hospital, and she carries our family benefits. And if we were turning 65 next month, we would jump onto the supplement in the drug plan and drop the group insurance, and she would continue to work, earning her wages, and we would just get a better value for our insurance dollars jumping on Medicare. But that's not always the case. Sometimes firefighters, police officers, judges, teachers, some occupations, federal employees, unions, sometimes the employer group benefits could be more economical than Medicare. So the reality is, if you have access to employer group insurance because you're working full time and you're eligible for Medicare, we're just going to look at all 3 options. We're going to look at the employer group insurance, look at what the cost is, look at what the benefits are, look at what the out-of-pocket cost exposure is, compare that to Med Sup or Med Advantage with Medicare, and the numbers will do the talking.
One more question. Sorry, I don't wanna hog
No,
everything.
I appreciate the questions.
If your spouse has an age difference between you and you are becoming eligible for a Medicare and you take it,
Yeah.
what options you have if she's a non-working spouse?
It's a great question, and it's a hard answer. Okay, so there's lots of people that work beyond the age of 65 and stay on their employer group insurance so they can continue to carry healthcare benefits for their spouse. For the people that turn 65, are eligible for Medicare, opt out of employer group insurance so they can take advantage of Medicare options, the spouse is going to have to go in the marketplace or ACA or an alternative healthcare plan, which I can tell you is going to be pretty expensive unless someone has limited income and they're qualifying for subsidies. So there are lots of people, if your wife is 2 years younger than you, then maybe you would stay on employer group insurance until you get him or her to age 65, because going on the exchange or the marketplace or the Affordable Care Act and getting health insurance can be cost prohibitive for many families.
So basically, you don't have a choice. You have to stay on your work insurance to cover your spouse.
We have to look, yeah, we definitely need to dig into those options and look. And when I see that situation, most of the time, people are going to work beyond the age of 65, stay on employer group insurance if they have a younger spouse. It's going to make the combined picture more affordable than jumping on Medicare and then looking at the marketplace for the spouse.
Thank you.
Very welcome. Any other questions?
What Medicare, home health? Home health.
So home health care's, there's multiple forms of home health care. So
No, not healthcare, only the home, other home health.
home health care.
Thank you.
Yeah, home care.
Yeah.
So what's interesting is there's skilled care, which is care provided by a doctor or nurse or skilled medical professional. And then there's also intermittent care, which would be like physical therapy, speech therapy, occupational therapy. And there's also custodial care, which is just help with day-to-day activities. So Medicare covers skilled care. So you need a doctor or nurse to get better, heal, and recover. Then that type of home health care is covered by Medicare.
That's home health care. What about domestic health, just for other cooking and then?
There's lots of home health care services. In order for Medicare to cover the cost, it needs to be skilled or rehabilitative care. So one of the challenges is 90% of people, as we age, get older, slow down, most of the people that are in a long-term care setting, like a nursing home or assisted living, is usually not skilled care. That's usually custodial care, which is help with day-to-day activities, dressing, eating, bathing, toileting. And Medicare doesn't cover that. Unfortunately, people self-insure that cost, or they buy long-term care insurance to insure against that.
What about Medicaid?
Medicaid will cover skilled nursing homes. So if someone qualifies for Medicaid based on their income, usually the Medicaid income limit's probably around $1,200 a month or more. You're not eligible. $1,200 a month or less probably could qualify for some Medicaid benefits. Medicaid would cover long-term care in a skilled facility. It's not going to cover care at an assisted living, and it's not going to cover custodial care in your home.
Any of the advantages we have covered?
There's basically no solution for long-term care. It's a completely different topic. So Medicare will cover home care if it's skilled or rehabilitative. So you have a stroke or heart attack, you're in the hospital for a few days, they get you straightened out, they send you home, you're doing some rehab for 3 weeks, 4 weeks, 6 weeks. Medicare will cover that. someone maybe dementia, Alzheimer's, physically are good, but just forgetful, memory loss, stuff like that, Medicare's not gonna cover that.
So what you substitute with? So what you substitute with? If Medicare is not covering for those kind
Can
of
you buy a
things,
policy for that?
what you're looking at, to take another step for getting some.
So, if we're talking about home care and long-term care, assisted living, nursing home care, because that stuff financially can be very devastating. On average, we're talking $6,000, $7,000, $8,000 a month for long-term care. The only option is insurance, and the insurance is very expensive, and you have to qualify for it. So if someone's sick, they're not going to qualify for long-term care coverage, and long-term care coverage has nothing to do with Medicare, basically. Medicare would cover acute care 100 days or less, which many people can self-insure 100 days or less. 3-4 years, long-term care could be financially devastating, and you have to buy insurance for that and be insurable to get the coverage.
Don't this supplemental insurance come in to help you in this situation?
Supplemental insurance, whether it's the supplement or the Advantage plan, is designed to cover Medicare approved expenses only. And Medicare doesn't cover long-term care, so that's a whole different beast.
Is there a limit on the number of days for hospitalization in any of the plans?
So what happens is Medicare covers long-term care for up to 20 days. And then your supplemental insurance would cover days 21 through 100. And so you basically have about 90 days worth of long-term care coverage with Medicare and a Medicare plan, if it's still rehabilitative care. After that, you're on your own. And since we're talking about long-term care, it's no secret, you can Google average nursing home cost in Chicago, $6,000, $7,000, $8,000 a month, $100,000 a year. Probably the only catastrophic risk that most folks have not protected against. And when you're 50, you're not thinking about it. When you're 60 and 70, you're probably not thinking about it. And when you go through a personal experience with some family members, you learn about it. And then hopefully you're healthy enough to qualify, and hopefully you can afford the premiums if you want to protect against that catastrophic risk. And I would say probably only 10% of the population insures against long-term care situations because the cost of the insurance is outrageous as well.
Question, coming back to the very first question I asked you. If I'm getting 65 and I don't choose to take that cover from Medicare, can subsequent I come back to it, or there's a penalty because you said if you don't enroll?
No, great question. The question was, if I'm working beyond the age of 65 and I have employer group insurance through the company I work for or my partner's employer, will I be penalized if I opt out of Medicare Part B because I don't want to duplicate coverage or premiums? And the answer is no. Because you have credible coverage through your employer, you can jump onto Medicare, free pass, no underwriting, no penalties, once you decide to retire and give up your credible insurance coverage through your employer.
What about coverage A? I'm automatically enrolled in that.
Because A is free, we usually tell people to take A because there's no cost to
So
it.
you can pick and choose between A and B that I really want A.
Yes, you can opt out of B since there's a cost to it. And then you can pick B back up without a penalty when you decide you're done working, it's time to retire, in which case usually then you would lose your group insurance. You can pick up Medicare at that time.
Another question
Related to that, you still have to provide proof that you were the employer when you opt out. You know what I mean? When you quit your job.
Yeah.
And you didn't enroll enroll at 65.
Right.
Still have- you can't- What are the rules? You still have to provide them proof that you're covered.
Yes, what happens when you apply for Medicare when you're 68, because you worked a couple of years beyond the age of 65, you're gonna have to get a letter from your employer showing that your employer group insurance is gonna end on such and such date, which is gonna be the last day of whatever month that is. And your Medicare starts the first of the month, as well as any insurance, not life insurance, but health insurance. And so in order to get the guaranteed issue, no penalty, all that stuff, we get a letter from your employer telling Medicare, hey, this gentleman's had employer group insurance. It's ending at the end of June, so you can start your Medicare July 1, no penalty, piece of cake, no underwriting.
I'm gonna take you into the weeds now. I'm working past 65. I get terminated or I leave my job and I'm without a work for 3 months. And then I go back to an employer. What happens in that gap period if something happens? Or I have to get another insurance like Obamacare or whatever?
No, so you can opt out of Part B at any time.
Okay.
Once you're
I'm not in Part B. I'm only in Part A because that's
okay,
provided.
yeah,
I'm working past 65.
Yeah.
And then I leave and I take 6 months. I don't want to work.
yeah.
And then after 6 months, I want to go back and work. I can get to the employer's plan, but the gap that I have. what am
So
I-
when you leave the first time,
Yeah,
you're gonna pick up Part B right then.
okay.
And then if you decide you're bored out of your mind and you gotta go back to work, do the math.
Okay.
9 times out of 10, you're gonna go back to work, pick up your paycheck, and you're gonna keep your Medicare as is and probably not go back to group insurance. Because 80% of the time, Medicare is gonna be more affordable than employer group insurance.
Unless you have a spouse. with age difference.
Exactly. 100%.
Under Medicare, each spouse can pick up.
Thank you very
Let's say
much.
one spouse is healthy, can just take advantage. The other spouse is not like if the employer where the whole family gets locked in. You have to pick, right?
Yes, exactly. So everybody's health is different. So sometimes husband and wife, you know, if someone's sick, usually they're gonna jump on the supplements so they don't have any out-of-pocket costs and co-pays. And usually if someone's healthy, they don't wanna pay for Cadillac insurance that they don't need. So it's not uncommon to husband and wife to go 2 different routes with their Medicare plan.
Or can they enroll the same, does it have to have, is there a relationship?
There's no relationship.
Each one is for,
Yeah, there's usually like a household discount,
that's something.
you know, if your partner's on a AARP Medicare supplement and then the second spouse is gonna apply, they'll usually give you a household discount, a discounted rate to have 2 insureds under the same roof. But other than a household discount, it's about the only difference. Go ahead, sir.
A little misunderstanding. I thought you said that we can keep dual insurance like Medicare and Public Aid. You Medicaid, Medicare and Medicaid, you can keep both. If I go with the Medicare, a doctor is taking $40 for copay. And then I say, okay, no, use this card, Public Aid.
So for the folks that have Medicare and Medicaid, there are dual plans, which are Medicare and Medicaid plans. And so there are no co-pays on the dual plans because Medicaid subsidizes the out-of-pocket cost sharing. So for the folks that don't have Medicaid, there's co-pays when you see doctors, go to the hospital. If you're on Medicaid, Medicaid to me means free health care. And the reason why, if someone has Medicare and Medicaid and they're eligible for free health care, then why would they still sign up for a Medicare plan? And the answer to that is because they're gonna want dental, hearing, vision. The dual plans have an OTC card where every month the people get $100 or $200 a month for groceries and utilities. And those are all ancillary benefits above and beyond what Medicare covers. Original Medicare doesn't cover dental, hearing, or vision, which is why a lot of these Advantage plans are popular. And even if you have Medicare and Medicaid and you're eligible for subsidized health care, you'll still want a Medicare plan. It won't cost any premium. There'll be no out-of-pocket costs, and you'll get to take advantage of those additional benefits: dental, hearing, vision, OTC card, gym membership, etc.
Another thing, supplement plan, it work internationally also, if you travel.
Yeah, so the Medicare,
One of the other plan, like Advantage.
when someone's on the supplement plan, Medicare is your primary insurance, and the supplement is your secondary. Whereas if you're on the Advantage plan, the Medicare Advantage plan is your primary insurance, and Medicare is the secondary. The supplement does have international coverage, and there is a $50,000 limit.
Which one?
$50,000 international coverage limit on the supplement. So for folks that are traveling across seas, the supplement plans travel well. The Medicare Advantage are more local plans, and they're more network driven. And you can see out-of-network providers if there's an emergency. It's just some people debate who determines if this is an emergency, because the client's going to always say emergency, and the medical administration, there's limitations traveling not only out of your local area, but especially internationally, would turn into an arm wrestling match with the insurance carriers on an Advantage plan.
If you're planning an international stay, which one would you recommend? Longer than a few weeks or a month?
Or let's say you're retired.
Yeah,
and
I wanna
you
retire.
stay overseas for 3 months, and you come here for 3 months. It would.
Well, supposed to be, if there's an emergency, your health care is going to take care of you. Emergencies only. So for non-emergency care, if you're out of the country, you don't have any coverage on an Advantage plan.
What about the supplement?
Supplement, there's coverage
What would cover?
for non-emergency care for up to $50,000.
Well, let's say you live in France for 4 months, or whatever, then you come back. You can go and see primary care physician and specialist and eye doctor.
Absolutely.
Oh. Well, how does it?
With the Medicare supplement.
How do you submit the claim?
Just like you would any other way. So the insurance carrier, so all the carriers have both options. So Aetna, Anthem, Humana, WellCare, Cigna, Blue Cross, they usually all have the supplement and the Advantage. And the supplement's going to allow you they're going to cover international medical services on the supplement. And you're going to argue with the insurance carrier if you're on a Medicare Advantage plan for international coverage if it's not an emergency. But if you have a heart attack, you're going to be okay. It's going to cover. You're going to pay co-pays.
So is that something you pay out of pocket and get reimbursed, or you direct that facility provider to bill?
So normally you would just pay copay. But if you're on an Advantage plan and there's an emergency and you're out of the country, it's probably going to be, pull your credit card out and pay for it and argue for reimbursement with the insurance carrier when you get stable and recovered, and
Good luck.
and have fun with that.
Long-term disability is maximum 90 days. And if it is a permanent disability, what's going to happen?
Yeah, I was going to say short-term disability, I think, would be 90 days or less. Long-term disability could be indefinitely, and there's both. There's short-term disability, there's long-term disability, there's disability income protection through your employers. So depends on what you have. But there is a difference. between short-term and long-term disability.
So when the short term turns into a long term, is there a time period gap between 90 days and whenever the long term kicks it in? Or is that after 91 days? It's not?
You know, I think usually the employer group insurance that employers offer, you know, where it's kind of like group life insurance, you can check a box and they take out another $9 a week for short-term disability. That's probably pretty cut and dry, 90 days or less, or 180 days or less, or whatever the term is for short-term. Long-term disability is just like long-term care insurance or life insurance. It's something that you have to, you know, buy from an insurance carrier. I'm a financial advisor with Mass Mutual, and they have a long-term disability contract that we market and offer. And long-term disability, just like long-term care insurance, is very expensive.
Also for the companies, the day one you come off the short term, you get into a long term if you picked up that plan. So that's an automatic switch typically.
If you picked it up.
If you picked it up.
And no one ever does because of the cost associated with picking it up. But yes, if they did, piece of cake.
So when you refer long-term care, so is also like this assisted living is also same category like the old age home?
Yeah.
Okay. Pretty expensive.
Very expensive.
Okay.
$6,000, $7,000, $8,000 a month.
Wow.
Yeah. So it's crazy because for the people that have, you know, I mean, you can blow through $1 million of savings and assets with a long-term care situation. If you've got an aging parent that has dementia, they can walk and talk and eat and go to the park. They just may not take their medication on time, right? So it's more supervision, and those people aren't dying quickly, you know, and the cost of long-term care is catastrophic.
Maybe an autistic child as well?
A what?
Autistic child? Autistic child? Not same.
Autistic child?
Maybe same category.
Yeah. You know, autism probably would be that SSDI where you would get Medicare under the age of 65 because of that disability. And so you might be okay with that type of diagnosis. As far as some of the programs in Medicare covering a lot of that stuff. My nephew's autistic and needs a lot of help and assistance, and
most child they get $3,000 a month, right? From Social Security.
For what?
For autism, they get $3,000 every month.
I don't know those numbers, but I wouldn't be surprised if their SSDI was in that ballpark, because, you know, a lot of those folks with autism, it's a, you know, I guess there's different scales, but that's a, you know, most of the folks with autism aren't ever going to work.
Yeah.
You know what I mean? So they qualify for disability benefits that they use to live on, pay their bills. All right, guys. Any other questions? Thank you so much for having me.
Thank you.
Appreciate it.
Very much.
Thank you for coming.
Let us know if you have any questions. We're happy to help you, friends, family.
Is there any contact information you can leave with us that we can
Yeah.
circulate?
Yeah, I'll throw some business cards up here on the
That'd be
table.
great. That'd be great. We'll make sure that we put them out there.
Thank you.
Just to turn into there's a different market for your P64 required, you know, and this time.
Please take a business card. If you guys are around with any questions, you can reach out there on the table.
Have your business card if you have one. You can set up together. In Shamrock, they are very good because in different zip codes, the different options available in terms of plans. One plan may be available in a certain zip code, may not be available in that other zip code.